Okay, this is the last meta-analysis on this to answer the same question on Plavix and the CYP2C19. In this study, meta-analysis, in addition to answer the question related to CYP2C19 loss of a function, and this also have a gain of function. I think in our previous review, we talked about the asterisk 17 and even asterisk 19. Those are gain of function, which means they can convert Plavix from a prodrug to active form, either unable to, if it's a loss of function, or more converted. So these study meta-analysis of the association between cytochrome CYP2C19 loss and the gain of function, polymorphisms, and the cardiovascular outcome in patients with coronary artery disease treated with clopidogrel, which is a Plavix. So this is just a trivia, and clopidogrel is generic. It is a generic name. The trade name is Plavix, and the Plavix become a generic when in 2012. Just for review, in 2010, FDA issued a box warning that those who has CYP2C19 loss of function, requiring either genetic testing or using alternative instead of using clopidogrel, rather using the other alternative for anti-platelets effect. This article is a systemic review. If you recall the pyramid of evidence, this is on the top of the pyramid review, systemic review, and the meta-analysis. That being said, this was published in 2011, which is right after the FDA box warning. Interesting enough, okay, I'm going to let you, we're going to go over the results of this study and just put your critical thinking hat on while you analyzing this one and see the FDA warning came out in 2010, but most of the study reviewed in these meta-analysis, the studies cited before 2010. We're going to go over that one. And the scientists did most of these studies, I think they're from Spain. Yeah, okay. So School of Medicine, Girona University, Spain. So the abstract, what are questions they tried to, what the answer they tried to search for here is to perform a meta-analysis of the association between CYP2C19 loss and gain of function variance and cardiovascular outcome. And bleeding, this is one of the other studies, if you recall, they also did a bleeding because that's one of the side effects in patients with coronary artery disease treated with clopidogrel and explore the cause of heterogeneity between studies. Method, comprehensive literature search, if you remember the PRISMA, it's a method to identify the research here, and they use the comprehensive A random effect model was used to summarize the result. In the presence between study heterogeneity, a method regression analysis was performed to identify study characteristics explaining this heterogeneity. Results. Patient with a carrier of a loss of function anemia, mainly CYP2C19 asterisk 2, did not present an increased risk of cardiovascular event. If you, so this is studies did not support the the hypothesis. The HR, the odds ratio, sometimes they call it the HR, sometimes HR is hazardous ratio. Sometimes they call it the risk ratio is RR. Sometimes they call it the OR is odds ratio. It's 1.23, 95 percentile confidence. But this one, when we see it, you will see it's not statistically significant because it touched the line of line of effect. Substantial heterogeneity was observed between studies, and I square is 35.6. That's pretty decent, which was partially explained by the study sample size. The pooled HR was higher among studies with a sample size less than 500 patients. HR 3.55, 95% high confidence interval, and lower among studies with a sample size greater than 500. You almost feel like it should be the other direction if you think about the effect size, right? CYP2C19 asterisk 2 was associated with the increased risk of stent thrombosis. HR is 2.24. That means there are 2.24 times risk increased comparing with those who does not have this deficiency in their genetic makeup. The gain of function anemia, mainly CYP2C19 asterisk 17, was associated with the lower risk of cardiovascular event and a high risk of major bleeding. If you think of it's just the opposite to someone carrying loss of function. Conclusion. Not only CYP2C19 loss of function, but also gain of function anemias should be considered to define the pharmacogenetic response to clopidogrel. So this is the study put emphasis also on 17. The gain of function. The results question the relevance of CYP2C19 loss of function anemias in the prediction of a major cardiovascular event beyond the standard thrombosis in coronary patient treated with the clopidogrel. The gain of function variance is associated with a lower risk of cardiovascular event, but a high risk of bleeding. So just to digress a little bit, because in 2010, FDA issued the box warning, basically said you need to look into these CYP2C19. And also it was prompted by the lawsuit against the FDA related to the Asian population, because that's from Hawaii Attorney General. They basically say that those Asian population have a high tendency to have CYP2C19 asterisk 2 or 3, deficiency, loss of function anemias. Therefore, they should be brought to the front before you prescribe clopidogrel. Otherwise, they could just take in clopidogrel thinking decreased risk, rather they are going to develop a cardiovascular event. However, the conclusion in 2011, based on 13 studies in this review published in 2011, did not give consistent data on that for the loss of function, other than the stent thrombosis. So we're going to talk about guidelines once we get there. Same as other reviews we have done, this is the fourth one, I believe. And basically they did the same strategy. They looked in the literature. They have 179 using the keywords to searching for the answers, right? And 92 manuscript excluded after the review, 87 remaining, the 74 excluded after abstract review. As title review, abstract review, basically say 13 of them appear to be relevant. Then they have one manuscript excluded for not meeting the inclusion criteria because they have to answer the question, right? And so basically the study included in this meta-analysis, we have 13 studies. Let's see what are the questions they try to answer. The questions scientists here want to get answer is how this genetic makeup with a loss of function, gain of function, in relation to major advanced cardiovascular event. This is a MACE, right? This will define any cardiovascular event recurrent ischemic or even death related. The second is they want to know how this related to thrombosis, because stent insertion requiring dual antiplatelet therapy, and if these patients have loss of function and theirs could potentially not benefit from taking clopidogrel. So they want to look into that post stent in relation to thrombosis development. Third one is a major bleeding, because they have the data on gain of function. They want to see those people comparing with the loss of function. Do they have increased risk for bleeding? So that's basically the questions they try to get answered. I'm going to turn this one view clockwise here. So you can see this is the same method we used in other studies for meta-analysis. It's very standard procedure. So this author's year of publication, this is very important for you to review in this case, because all the studies included is prior to 20, it's equal or prior to 2010. And there are Germany, Poland, USA. This is very important because the population related to CYP2C19, it is reported that Asian people with Asian ancestry, Pacific Islanders, of course, have a higher loss of function carriers percentage. And this, of course, sample size, mean age, those are the ones will be, once you analyzing the data, you say, oh, I want to see what exactly, how many people included in that study. So this all the outcome listed here, follow-up is 1 year. So this also will change the analysis interpretation, right? And so here are the studies, 13 of them. Let me rotate back to clockwise result and meta-analysis. This is a little bit different layout from the way we saw before because we usually see the study on this side and the forest plot on this side, and the heterogeneity is right, it's different layout, but it's all good. Okay, so let me shrink this a little bit. This is too small. I can barely see. Okay, maybe 150. Okay, so this is good. And if you take a look of a forest plot here, and the questions here is risk for major cardiovascular adverse cardiovascular event. And the patient are treated with clopidogrel, the presence of a CYP2C19 loss of function layers. So here is the result. On this side is increased risk. On this side is less increase or no increase of risk. And the people with loss of function would have a loss of function here, right? And you can see that this study basically said there's no increased risk rather than decrease, increase. This one is significant because the 95 percentile confidence interval did not touch the line of effect, which is 1, right? And this one touched, so it's not significant. And this one also not significant. This one is very good. However, the square is not that big, so the effect size is not nearly as big as this one, right? And this one is significant. This square is bigger than this one, so the effect size is bigger. This one is not significant because it touched the line of effect, so none of these is significant. Basically say here, the diamond is a poor hazardous ratio it's touched the line of effect, therefore it's not significant. So they further divided them to greater than 500 individual in the study and found out the effect still not significant. Then they said that we're going to only collect those data and analyzing the data from those less than 500 individuals in the study. And notice this one is significant. So in general, if you see the pooled HR, you can always, look into details, but it does not give a strong evidence. Rather, the strong evidence is not related. And the heterogeneity here is 35%, which is decent, right? So the next result here is a risk of a stent thrombosis. This is after stent insertion. And let's take a look for the loss of function, increased risk or not. What do you think here? The study have these data as a 1, 2, 3, 4, 5. Okay, 1, 2, 3, 4. Have a 7 studies. Have that information. So again, loss of function would have increased risk after with a stent thrombosis. The first study is not significant, second one is, and the effect size is good. So after you see this one, you have a feeling that this one may have something to do with the loss of function layers. And this one also very good because the effect size is bigger and 95% higher confidence did not touch line of effect. So this one is not significant. This one is not significant. Even the effect size is big, and this one is not. So you can see this already that you are going to plot a pretty good size of chord. The odds ratio here is the diamond. The diamond, just to review, the center of the diamond here is the mean, and this is 95% higher on both sides. So you can see the average here is 2.24, starting from 1.52 to 3.30 with 95% higher confidence. So basically say here, those, let's read this one. So those who received the clopidogrel after the stent insertion, if they have loss of function layers, they will have a 2.24 increased risk of developing. The outcome here is ACS, acute coronary syndrome, cardiovascular event will have a increased risk for that. So that's exactly the discussion is going to be involved. And if you recall the bleeding, if those who has a gain of function, if you recall this research actually looking into the gain of function layers. So basically here is the risk of a major cardiovascular adverse event in coronary patient treated with a clopidogrel, according to gain, if they have a gain of function layers, and what is their the bleeding risk. Oh, sorry, this is why it's not a bleeding risk. The outcome here is a MACE, is a major adverse cardiovascular event. So if they have a gain of function layers, they are significantly associated with less MACE event. Certainly, we don't have a lot of research out there. So only 4 studies, and 3 of them reported that the third one appeared to be touched the line of effect. And so 2 studies very support that. So here basically say, if you carry gain of function, which is aspirin 17 based on the study definition there, and you have, decreased risk here. You have a 75% less odd ratio to develop MACE. So this is the next analysis statement. This one is the bleeding. let's see the answer. Risk for major bleeding in coronary patient treated with the clopidogrel according to the presence of gain of function. Very interesting, because this is the largest effect size. So this one is not significant, this one is not significant, this one is not significant, but this one is significant. So because of this effect size, and because also the large sample size, so that's probably the reason it pulled the result as it is. So basically, say is one, if you carry a gain of function layers, you have a 1.26 increase ratio odds times you 1.26 times more than those who does not carry gain of function to develop bleeding after you taking clopidogrel. So that's the review. We have done all the reviews for the meta-analysis related to Plavix, related to loss of function or gain of function analysis. And to conclude, if these loss of function to answer our question, if loss of function genetic makeup would increase, have increased the risk comparing with those who does not carry loss of function alleles. In patients who takes clopidogrel. You can see, the conclusion is not so consistent, especially if you see the study prior to 2010, the box warning. It's really, there's no good data to support that. If you have any questions, we can talk more in class. And